This is Talk with Gaetano on Urban Television. Once again, good evening and thank you so much. And with me in the studio, we have Dr. Michael Muhame, who is the Director of Medical Services and Pediatric Intensive Care Specialist at IHK, telling us about his journey, what he's gone through, what he's seen, why he came back. He could have gone to outside countries and stayed, but no, he's back as a Ugandan, helping Ugandans, of course, and doing the right thing as far as I'm concerned. Let's come back to you, Doctor. Let's talk a little bit about, I know we don't like politics in Uganda, but when it comes to what we're discussing. Recently, the government is proposing to scrap the internship facilitation. I heard something about that. I don't know if you know about this, and what do you think about the move, if this is the case? Because you had to go through internship.
Yes.
And I'm sure you were facilitated by government, unless it was a private arrangement. But scrapping it, do you think that would be a good move?
The government has a limited budget. It has priorities. We know that healthcare does get an annual allocation, and I guess the need is great. The resource envelope is very slim. But what I know for sure is that interns have done 5 years of medical school. Now, with especially the privately, paying students, they have spent a lot to get to where they are. There's a small group that's paid for by the government, as part of the government scholarship program. But when after 5 years of relying on their parents for upkeep, for sustenance, or doing odd jobs, you would want an intern to sit and focus on the job of internship, not worrying about how to make ends meet, about how to get food on the table in the evening. There's interns who are married, who have families, who have children. You don't want them, working after hours, quacking as they call it, because they do not have a license for that at that time, to try and make ends meet, because at the end of the day, they must make ends meet. They are rendering a service, which is a noble service. Most interns work very long shifts, and it's only fair that they be remunerated for that. Most other countries will do that. The countries like South Africa have skirted around that because they also suffer from a significant doctor shortage. They pay their interns really well, but they bond them for an additional 2 years to work for the government. They send them to the rural areas, but they keep them around by paying them and paying them relatively well. So you then have someone in the system for about 3 years. And for a medical officer, that's about how much you should get out of them. After 3 years, they should be thinking, I need to move on to the next level. I need to go back, train, become a specialist, and then come back and render service as a specialist. So in terms of whether that facilitation should be scrapped or not, with all the other considerations being taken into account, it's probably not the best move at this point.
Okay.
Because they will be forced to find other alternatives, which may not be the best for our health sector.
Well, we hope they don't. Now, consultation fees.
Yes.
This is one of the areas that not only myself, but many people I know just say, all I did was go into his office and see him for 3 seconds.
Yes.
The man is charging me 60,000 in consultation fees. Do you think consultation fees are a good thing?
Of course, it's the doctor's trade.
Yeah, but I saw you for 10 seconds, 5 minutes, and and all you prescribed was Panadol. And now,
and now you pay.
Yeah.
So I guess you're probably referring to the Medical Council announcement.
Exactly, the Medical Council, and that's where I was going to come to, because they released a report, Professional Fee Guidelines for Healthcare Professionals in Uganda, which will scrap such things as consultation fees.
I haven't read the report per se, but I don't think they're proposing to scrap consultation fees. I think what they're doing is to try and keep the fees reasonable and affordable, because on one hand, delivering a good healthcare service is expensive. If I work in the ICU, setting up a single ICU bed space, when you think of construction, then the civil works that must go in, then equipment, fittings, furnishings, and the staff, training staff to work in that ICU. When you think of one bed space, it could easily set you back $100,000. So when you run a 10-bed ICU, you will approximately need $1 million if you start from scratch.
Right.
Now, the kind of care you offer in an ICU setting, the things you must buy, none of them are made locally. The drugs you must use are usually third, fourth line drugs of last resort. These are drugs that are sold by their parent companies at astronomical prices. So, for example, ICU care is expensive. In the US, you will easily spend $10,000 a day just to get ICU care. In a country like South Africa, it comes down to about maybe $1,000 to $3,000 a day, depending on the level of care you need. In Uganda, you'll spend anywhere between 1.5 and 3 million a day per day. That includes consultation fees, drugs, and all the other
There's a
items
consultation fee
that you
again.
have to use. So, but then you do have cases where you have patients who are overcharged by doctors. So, for the kind of service you have received, you could have received a similar service at a much cheaper price. So I think what the Medical Council is saying is, look, there's people that need a service. Can we sit at a round table with the doctors and agree that this is the cost at which a patient can access this service? The lawyers have done it. They have, charges they stick to, minimums and maximums, and you actually can't go below the minimum. So I guess it's prudent for the Medical Council to step in and try and regulate that field. Whether it's going to be easy or not is another question altogether, because there's doctors that have invested significantly in obtaining their skills. They've funded their own training outside Uganda. They've probably taken bank loans to do that.
To do that, yes.
So they need to, pay back that loan, but they also need to make ends meet. They need to live. They need to invest in the hospitals themselves that they have set up. So it's always going to be a bit of a debate, but it's prudent for us as doctors to say that if a patient needs service A or service B, let's try and deliver it within this.
So it has to be standard across the board, not one
probably
doctor.
a range.
Yes, a range.
A range.
Okay.
Yes.
Okay.
So that the patients also know, if I need this service, this is approximately how much it's going to cost me.
Okay.
Then you know whether to sell a cow or sell
Doctor, what is, very quickly, what is the, in your profession and in your time as a doctor, what is the most, I don't know, and I with all due respect, because we're talking about lives here, some of the things, one of the most, I don't want to use the word gruesome, but perhaps maybe the most painful, because you see a lot in your profession, the most painful thing that you've seen or had to operate on?
I haven't done much surgery in my...
Or maybe you just seen or dealt with a case.
So, yes.
Without giving names or,
No, I work in the intensive care unit.
Which is, we see a lot of...
Which is where the sickest patients are. And because I'm also a pediatrician, I work with children. The most difficult moments are when you have to stand before a parent or sit before a parent and tell them, sorry, but your child is not going to make it. And you've done all you can. You've offered all the care that they can receive in Uganda. But even in my training in South Africa, there's only so much you could do. At the end of the day, we are still human beings. We're not God. But those are very difficult moments, and you never get used to that. Losing a child, sitting in front of a family and telling them, your child is not going to make it. Those are the hardest days, but there's ways to cope, and my faith does help a lot in those
I'm sure
times.
It does. Yeah, you have to.
Yes, it does help.
Seek guidance.
Yes, and the days when all else has failed, and we've seen patients who have miraculously survived simply because families got together and prayed and waited on God, and the doctors did everything they could, and at that point when we thought we'd done everything else, then we get amazed and the children pull through.
That's fantastic.
And those are the best moments.
Yeah,
those are the best moments. So you do have a balance of...
Would you want your own children to follow this career path as well of being medical personnel or doctors?
The one thing I've decided is I won't push any of them to become a doctor. Because I've seen it takes its toll on family. It takes its toll on your social life. it takes its toll on other relationships.
You have to find a way of being able to do your job and still spend time with your family.
And still spend time with the family. I'm very fortunate. I am married, so my wife picks up a lot of that, especially with the children. She's able to, pick them up from school and things. But whether or not I'll encourage my children, if they choose to become doctors, I will stand behind them 100%. But if they say, look, Dad, your life is a little bit too much for us, maybe we'd rather be teachers or, this or that.
Fair enough.
I'll still support them.
Okay.
At the end of the day, that's what parents are for.
Absolutely.
Yeah.
Well, Dr. Michael Muhame, thank you so much for being on Talk with Gaetano.
It's been a pleasure.
It wasn't too much of a hot seat, was it?
Not as hot as I thought it
Not as
would
hot,
be.
not as hot as you thought it would be. Playing rugby is hot, I'm sure.
Playing rugby is, hotter and probably better than sitting here.
Thank you so much for coming into the studios.
It's been a
Director
pleasure.
of Medical Services and Pediatric Intensive Care Specialist at IHK. I think you're doing a fantastic job. I think medical practitioners in Uganda are given sometimes the rough end of the stick, but you do your best, and we do appreciate your services.
Thank you very much.
All right. We're going to leave it there. Do remember that being a doctor, they do have their codes. They do have to make a living. They will charge you consultation fee, but like we said, hopefully get a range in which they stick with instead of just bouncing all over the place and giving you a Panadol and charging you $1,000,000 shillings for it. But on a serious note, we do appreciate all the work that these doctors are doing for us and continue to do for us. We'll be back same time tomorrow. Until then, have a wonderful evening. Talk with Gaetano. It's a wrap. Gaetano drops mic. Bye-bye.